The homeless crisis in Louisville, Kentucky. My hometown of Louisville, Kentucky has seen a 40% increase in the homeless population in the last 3 years. The amount of homeless individuals on any given night is 10,640 citizens. The reason I chose this population as my area of focus is because I fully believe in a strength-based and system-based theoretical approach to social work, and I believe that every human deserves access to safe housing. There's a significant need for permanent housing. However, data shows that an additional 31,000 affordable housing units would need to be created to address the homeless crisis, which would take millions of dollars and years of work. Although shelters are available, as of 2021, 55% of the homeless population were staying in shelters and 35% were sleeping on the streets. We need to figure out why 35% of the population is sleeping on the streets. We can practice cultural humility by asking the experts, finding out from individuals by speaking directly to them about why they're sleeping on the streets. Are there barriers? Are there specific reasons that they would choose a street over a shelter? We don't want to assume the why behind individuals who are not staying in shelters. Instead, let them tell you themselves. Why is homelessness a crisis? In general, it's the lack of affordable housing and high barrier emergency shelters. Louisville has seen an increase in 40% of the homeless population. There is not enough affordable housing to accommodate the entire homeless population. Additionally, a lot of emergency shelters are not low barrier shelters. What this means is that there are specific requirements to partake in the emergency shelter services, such as being sober, not being able to have a pet, strict rules, having to provide identification, having to participate in a program, etc. Additionally, some shelters don't allow families to stay together if it's an all women's and children's shelter or an all men's shelter. Unfortunately, we only have one low barrier shelter in Louisville, and it can only hold 100 people per night out of the 10,000 plus homeless individuals. The idea of low barrier shelters is simple. The requirement of receiving housing is very minimal, meaning that these shelters provide more flexibility and less no tolerance policy for families, women with older male children, people struggling with abuse issues, who might not be sober in the moment, more lax restrictions on check-in and check-out times, and more flexibility with storing belongings. Many cities have implemented low barrier shelters, including Seattle, Washington, which has made a significant improvement in how many that they have. Studies show that the clients who are utilizing low barrier shelters in Seattle have also shown improvement with housing stability, improved health, and overall empowerment and autonomy. Improved housing stability and improved health is said to be affected by the ability to utilize resources while in the shelters. Additionally, many clients reported that because of the low barriers, they felt less judgment and they were more likely to utilize other services as well because they felt like they were utilizing them by their own choice. They weren't being forced to. A similar approach was implemented in a domestic violence shelter in Washington, D.C. The shelter eliminated the need to show proof of safety risk, allowing women to make their own choices and did not force them to participate in programs. However, even without the forced participation, 3/4 of the women in the shelter voluntarily used services. This was attributed to the fact that because they had a choice, they felt more empowered, more in control, and more self-autonomy. Providing low barrier shelters and allowing clients to feel welcome, not judged, and in control of their own choices and actions is a great example of working through an empowerment theoretical perspective in creating confidence, free will, and autonomy. Engagement to implement low barrier shelters in Louisville, Kentucky. My role as a policy advocate is to first create an exploration team of members of each group of stakeholders. From there, I will continue to delegate roles and tasks to each group of stakeholders to create a collaborative network of skills, resources, and expertise to strengthen the implementation process. While there might be some widespread community support, we may face some opposition as well from citizens who feel like the funds could be better used elsewhere, or there may be some citizens who choose to deny that there is simply a homeless crisis at all. Along with community critics, there are also currently political leaders in Louisville who proposed a bill that essentially criminalizes homeless individuals, creating fines for them who sleep on the street, making it illegal to store their property, and limiting the time that they can seek rest in a public park to 12 hours. Unfortunately, this policy was approved in December of 2022 in a vote of 16-8. What do we know? We know that there is a significant lack of beds in homeless shelters, which leaves thousands of citizens with no shelter. We also know that there is only one low barrier shelter in Louisville. We need to know which already existing shelters would be easiest to implement low barrier requirements, and also the areas of town that low barrier shelters are most needed. We also need to know which barriers are most common. Additionally, we need to figure out how to fund the change in shelters. Low barrier shelters significantly benefit from increased security, health professionals, mental health professionals, and additional staff training, all of which needs funding. The overall target for change is to be able to remove barriers that keep individuals from seeking safe shelter and to provide a significant increase in the amount of housing available to homeless people. Positive change would look like making changes to already existing locations and converting them into low barrier shelters. In order to implement this change, we would need to find out what the most common barriers are to the individuals who are not qualifying for shelter, and the best way to do that is to let their voices be heard. The intervention strategy would first start with creating a community with members of each group of stakeholders. Each group of stakeholders would bring a unique skills and experience, and the clients will be able to tell us the greatest need and most common barriers. The government officials will be able to propose permanent policies and or be able to network with other potential funders. Shelter staff and police will also be able to collaborate and discuss what the biggest needs they will have in the shelter will be. And lastly, the media will be a crucial aspect of implementing this policy. The more media attention the policy gets, ideally, the more community support it gets as well. One of the biggest resources that we currently have available is the existence of homeless shelters already. This will cut down on implementation timeline and cost. It will take much less time to implement low barrier shelters because we're not needing to create entirely new shelters. We also have agencies already on the ground advocating for policy change, like the Louisville Coalition for the Homeless. Additionally, we have politicians who have openly spoken out against the recent amendment, and thus might be more inclined to support this policy. The specific goals of implementing this policy is to convert 5 additional already established shelters into low barrier shelters. The other specific goal of this policy is to increase the amount of individuals able to secure housing that were limited by barriers by 35% by July of 2024. This will be measured with data. Frequent surveys and clients will be asked to self-report if they have benefited from the lower barriers. If low barrier shelters are able to be implemented and the extra funds are there, this policy is very sustainable. The biggest resources needed to implement this policy is community and political support and funding. Media will also play a large role in gaining community support, getting the word out there about the policy, and gaining popularity and traction. One potential challenge to the implementation is safety. One of the low barriers includes sobriety, and in low barrier shelters, as long as you're not causing harm or disruption, it's not an issue. However, an increase in correctional officer presence will need to be there to ensure the safety of other clients in case someone is being disruptive. Another potential challenge is just simply a lack of space. As an immediate change, we can implement low barrier shelters and allow more people to qualify for shelter. However, this is a short-term solution because eventually more physical space will be needed. Lastly, some shelters may be simply unwilling to implement this change. Overall, there's a significant need for low barrier emergency housing. Research shows that due to restrictions and rules, many individuals, such as family, individuals with substance abuse issues, pet owners, etc., are not qualifying for shelter. Additionally, research has shown that low barrier emergency shelters have better outcomes on permanent housing, overall physical and mental health, and clients are more likely to utilize services if they feel like they're not being forced to. Although there's an upfront cost, in the long term, the amount of homeless individuals cost the city will decrease due to the clients utilizing services without pressure, including physical and mental health services, sobriety services, and overall increase in the change of permanent long-term housing. Please consider joining us to provide shelter and empower the vulnerable citizens of our community. Thank you.